Some news just coming in, and this has got to do with the data projection for deaths in India. Government sources have told India today that serious objections with data presented to show excess mortality. Data collection has happened and has always happened from 7.9 lakh data collection centers. COVID or non-COVID cases, all of it is collected from 7.9 lakh centers across the country. While there could be some discrepancies in terms of the deaths, it isn't to the tune of what has been projected by the World Health Organization. 10 letters of communication have been written. 10 letters gone from the Union Health Secretary's office, but there has not been any response to this so far. Government sources say this data is going to be presented before the Executive Board of the World Health Organization, which means that India is going to formally be challenging this before the WHO. It has already written letters to the WHO talking about the data collection and India's dissatisfaction with this method adopted by the WHO. A top health ministry source has gone on to say that in spite of the data being presented beforehand, the WHO could have analyzed this data instead of adding a footnote at the bottom. This source has called the WHO's actions clearly mischievous. We're getting you all the details of what the Union Health Ministry essentially is going to do this from here on, given that back home here in India, a political war is also broken out. Sources within the government of India say that indeed there could be discrepancies in terms of counting the deaths related to COVID-19, given the situation at that point in time, exactly a year ago, during the peak of the second wave of the pandemic. However, it's very clear that India is closer to the truth than the WHO, because the WHO's own method of collecting data is flawed, is what sources within the Union Health Ministry have told India today. The Union Health Secretary has also written several letters to the WHO raising this formally, saying that this sort of projection and the manner in which the data has been collected by the WHO is flawed at different levels, and that India has its own system of collecting the data. Why can't that be taken into consideration? India's system of collection of data of births and deaths has been in place for decades together, COVID or no COVID. Why couldn't this data be accepted is the question that the government of India is asking, is what sources are telling India today. So this is going to be challenged, is what the government of India, sources within the government of India, the Union Health Ministry, are telling India today. In fact, letters of communication have also been written by the Union Health Ministry talking about the manner in which this data has been collected and questioning it. They're also going to be raising it at the World Health Organization's Executive Board meeting, and this is going to be raised formally by India expressing its disappointment. We are going to put out this report for our viewers. The WHO has claimed that over 47 lakh people lost their lives because of coronavirus infection in India. However, the centre has refuted claims of the WHO and questioned its credibility. Here's more.
But that isn't the full story. The Indian government has come out strongly against the WHO, questioning the report at multiple levels. But if it's India's word against the WHO, let's ask some serious questions of the WHO, whose handling of the coronavirus plague has been a subplot to the global pandemic. Has the World Health Organization inspired confidence in its handling of the COVID pandemic, or has it been a global hypocrite, largely bending to certain clients? Like China, for instance, that reports no data whatsoever on COVID deaths and remains unquestioned by the WHO. WHO's claims on other countries fly blind when it comes to China, a nation that continues to hide the origin of the Wuhan virus till date. The WHO actually claims China's excess COVID deaths is amongst lowest in the world, a country that makes a mockery of its zero COVID policy by forcefully keeping its citizens under lockdown. When the world was suffering the first wave, China's COVID deaths suddenly disappeared from official reports after April 1st, 2020. China's COVID case count never went beyond 80,000 in the public domain, and the WHO never really made a noise about it. China has in fact continued to report thousands of new cases of COVID from April 1st, 2020 until January 8th, 2022. China officially counted 34,107 new COVID infections, including 12,000 in Hong Kong as per Johns Hopkins data. The University of Washington estimate put China's excess mortality at 17,900, including 10,600 from Hubei province, where the coronavirus was first detected 2 years ago. While the WHO report asks no questions of China, India is the only country to stand up to object to the claims.
That occurred after testing positive for COVID-19 were occurring in the first 4 weeks. So a cutoff of 30 days was given for the definition of death. So this is robust data that we have, and a robust definition that I think only NHS has used it in the UK, and we have used it. Many countries don't have this definition.
The data the WHO has used is more on hearsay evidence of what has been there in the media or from unconfirmed sources. That data itself is questionable, and to do a modeling on that data is not correct, and it's not scientifically a right thing to do. And especially when you have data which is more robust as far as the RGI data is concerned.
To apply assumptions based on a subset of states, based on reports that come from the websites and media reports, and then you come out with an exorbitant number is not tenable. So that's on the process, and we are disappointed by what WHO has done.
India has also presented its side of data collected. Earlier this week, the government released civil registration data showing 8.1 million deaths in 2020, a 6% rise over the previous year. Officials played it down, saying all the 4,74,806 excess deaths could not be attributed to COVID. According to official records, some 1,49,000 people died of COVID in India in 2020. While the China resorts to blatant human rights violation with its forced testing and vaccination, India carried out a smooth, voluntary vaccine drive, protecting more than 72% with one dose and more than 60% fully vaccinated. While China masters in data manipulation, WHO calls for better data monitoring from the world.
The WHO has repeatedly come under fire when it comes to questions surrounding China, but it refuses to learn from its past mistakes. An independent panel that was looking at the pandemic response said that China and the national
जन्म, बर्थ एंड डेथ, इसके रजिस्ट्रेशन को, इसके पंजीकरण को लेकर एक बहुत रोबस्ट सिस्टम प्लेस में है. A very robust system is in place as far as the registration of birth and death is concerned through the CRS, that is the Civil Registration System, जो कि रजिस्ट्रार जनरल ऑफ इंडिया के अंतर्गत आता है और ये 1969 के से चल रहा है, एक बहुत ही रोबस्ट सिस्टम है। और इसमें आप देखिएगा कि जो भी पंजीकरण होना है 2016 के बाद जिस प्रकार से ये पंजीकरण में इजाफा हुआ है, खास करके मृत्यु दर आप देखिएगा इसमें बिल्कुल सटीक संख्या रजिस्ट्रार जनरल ऑफ इंडिया आज रख पा रही है, इसलिए एक रोबोस्ट सिस्टम के
Shambit Patra of the BJP there talking about the manner in which the opposition has raised this issue. Politics, of course, has erupted over W.H.O.'s COVID death estimate after World Health Organization's report on India's COVID-19 death toll. Congress leader Rahul Gandhi slammed the Modi government, accusing the centre of lying. Taking to Twitter, he said that 47 lakh Indians died due to the COVID-19 pandemic and not 4.8 lakh as claimed by the government. He said that science does not lie, but Prime Minister Modi does. He's also urged the BJP-led central government to support the kin of those who succumbed to the deadly virus by 4 lakh ex gratia. The opposition has launched a scathing attack on the current dispensation, asking the government to stop spreading propaganda and to show the correct data. Meanwhile, the centre on Thursday rejected the health organization's report, criticizing the WHO's methodology of calculating deaths as statistically unsound and scientifically questionable. We have a series of reactions coming in. Let's go straight to them.
Either the government says that we don't care about WHO, or it says in a convincing manner that the WHO statistics are wrong, or it provides its own statistics to show that why what it has said is correct. What was the impact of the COVID pandemic? Was the government prepared to handle it? Did the government pick up the ability to handle it even as it unfolded? Or is the government trying to hide the facts from the people of India through manufactured statistics?
There are two questions that arise out of this. Why did the government suppress the numbers? The government still, of course, has not decided to compensate any of those COVID-related deaths, even though it was a disaster. The National Disaster Act was in force, which actually mandates the government to pay 4 lakh to each of the victims. It also raises another important question of the moral compass of the government. Are you not even going to recognize the dead of this country?